Hi, welcome to Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiening.
Thanks for joining us today. Today's topic is what to expect after your knee replacement. So you've had knee replacement surgery, you've gone home. What does the landscape look like for me now that I'm home?
Okay, I think the first thing to talk about when you talk about this is where do you go? So the hospital, you're at the front door.
Yeah.
Someone's got to come get you.
Yeah, fair enough. You're not going to be driving yourself home.
Can't drive home.
You'll need help with this. So somehow you've got to get yourself home. And are you going to go home for sure?
So not necessarily, and we have some other videos that not only go through what happens when you're in the hospital for a knee replacement, but also things that you should prepare for before. And one of the key ones that we've both talked about is you need to have a plan. So I would say the options for going home are, one, to go to your own home.
Yep.
One, to go to a friend or a family member's home.
Yeah.
3 would be to potentially go to like a convalescent care, almost like a temporary nursing home.
Yeah.
And then the last one would be the inpatient rehab. I think people can't really bank on that just because of the minimal resources that are available.
Right. And where you end up kind of depends on the big picture. How mobile are you? And we can predict this pretty well before your surgery. When you go to your pre-op visit at the hospital, they will be able to help you determine by asking you some questions and seeing what your living arrangements are like. They will be able to help you determine if you're going to be able to go home alone after, or if you're going to need to have a friend or family member stay with you, or if you're going to have to stay in a rehab center or a convalescent care center. But for sure, the vast majority of the time, you're going home.
Yeah, and every situation is different, so certainly discuss this with your family doctor, with your surgeon, and be prepared.
Okay, so you get home now. Am I going to be able to walk around the house?
So typically, when our patients leave the hospital, one of their criteria for discharge is that they have to be able to mobilize safely, usually with a walker, and to be able to go up and down some stairs. So yeah, you are going to be independent. You're not going to be fast. You're not going to want to do 50 flights of stairs, but you are going to be getting around pretty well.
And am I going to be having a lot of pain when I go home?
Yes. After knee replacement, you're going to be sore. It is a very manageable pain. It's going to require a bunch of different things, but yes, you're definitely going to be in pain. What do you tell people as far as the pain goes, Paul?
Yeah.
How can you control it?
I say it's like training for a marathon. An athlete training for a marathon experiences pain, but it's necessary to enhance his performance. So same for you. When you get home and you're with your knee and it's sore, you're going to be taking medications to help manage the pain. That's going to make it manageable. And even if you make the pain manageable, when you go to your physiotherapy, which is crucial, when you go to your physiotherapy, you're going to experience discomfort.
I totally agree, and that's why I have so many patients who come to me and say, hey, I didn't even use all the pain pills you gave me. And I go, because I want them to take their pain pills, because if they're not taking their pills, their pain's not controlled, so that they can't push themselves at physio. A lot of people are nervous about getting addicted to narcotics, which certainly I respect and I acknowledge that potentially is a problem. However, in the setting of acute postoperative pain, I'd much rather have you take the pills and control your pain so that you can really push hard, like Paul said, like a marathon. Just give it everything that you have every single session so that you can get a better permanent outcome.
So that's pretty well the most important thing for you when you get home is to attend a physiotherapy clinic. And some people ask about having a physiotherapist come to the house. I'm not a big fan of that because at your house you don't have the necessary equipment, and the kind of physiotherapy you get at your house is variable. Whereas if you go to a clinic and find a clinic or the hospital or somewhere where they have treated a lot of people successfully with knee replacement, they have experience in that area. If you go to that center, I think you will have a better outcome.
And we had talked in our what to expect before knee replacement video, setting this up ahead of time, maybe doing some prehab so that you know some of the exercises already, and maybe have already even met your therapist, and maybe even were so forward thinking that you may have even booked your first session before you had your surgery.
I think that's great. And I wouldn't mind if you became obsessed with your knee range of motion, actually. If you just thought, oh yeah, all I got to do is get this knee moving, range of motion of the knee, and become obsessed with it so that you're really focused on trying to improve that after your knee replacement.
I tell people that's their job, because they say, when can I go back to work? I say, you can't. Your job is your knee. That's the only thing you should care about. Right. 8 hours a day. I want you just to move it, move it, move it, move it. I think there's a song. There's a song. Yeah. What about swelling, Paul?
Yeah, there is going to be swelling. You're going to experience swelling. And how long will that last? It can be variable. It can last for several weeks, it can last for several months, it can last for 2 years.
Yeah. And not only just in the knee, sometimes the whole leg.
Yeah, the whole leg can swell up. So some people say, well, when can I go back to work? You mentioned work a few minutes ago.
Well, I wasn't done with swelling yet.
You're still going to swell?
Yeah, I'm still going to swell. So what I was going to say is ways to control that are with ice or a cooling unit like we talked about. Potentially even a compression stocking. Some people use over-the-counter or prescription compression stockings because controlling your swelling is really helpful to improve your range of motion.
Absolutely.
Now my swelling's under control.
Can I go back to work?
Can I go back to work? So what do you tell people? How long? How long to go back to work?
It's variable. Okay, so it depends what your job is.
Yeah.
How much you like your job.
Yes.
And if
someone's going to pay you to not be working.
If you have a plan where you can get paid to not be working to recover, I find people will use that time. Whereas if you're the type of person who is self-employed and your livelihood depends on you showing up for work, you will find a way to work from home or something.
Yes.
In general, very broad terms, I would say 6 to 12 weeks.
That's what I tell them too. I think that's reasonable. And the 6 weeks, probably the lower limit, is because I tell my patients they can't drive for the first 6 weeks.
Yeah, I'm the same. Don't drive for 6 weeks because your reaction time may not be as good. You will still be on some heavy-duty painkillers.
What if it's my left leg?
Still, even if it's your left leg and you're driving an automatic car, you're still going to be on some form of narcotic, probably for pain control. So it's not safe to drive. You're going to be distracted by the discomfort in your knee.
Yeah. So that's a guideline. Discuss it with your surgeon.
Yeah.
Surgeons are different, but certainly that I agree with you. 6 weeks is my standard answer.
Travel. I get asked that question. When can I go to Florida? When can I go to the cottage? When can I travel?
So that brings up a good point. One of the other things that I'm really worried about after surgery or concerned about is blood clots.
Right.
With any lower extremity surgery, there's a risk of a blood clot. So people are going to be going home on anticoagulation. Typically, I send my patients home on an oral anticoagulant. That's 2 weeks. And then after that, they still may have a risk of a blood clot. So on a side note, please beware if you have increasing amounts of calf pain, chest pain, or shortness of breath, you should see your doctor or go to the emergency room because that could be a sign of a blood clot or a blood clot that has moved. And then back to the travel.
That's what we worry about with travel. We worry about you sitting on a plane or in a car for a long period of time, immobilized.
Yep.
And that's what increases your risk of a blood clot.
Do you give them a ballpark date? Like how long?
You know what? I'll be honest. I used to say 3 months before you go on a flight, but I think people are mobilizing a lot faster nowadays, and people are generally, it's on a case-by-case basis. If someone is moving pretty well and they feel good, I'll let them travel at six weeks to 2 months.
I say 6 weeks for my knees. I tell my hips 3 months, and you can talk about our hip replacement video later because there's some specific issues related to the hip. So yeah, I think 6 to 12 weeks is probably not unreasonable.
Okay, and now blood clots are one thing you got to watch out for when you get home. What else do you have to watch out for as an indication that, hey, something might be going wrong here?
I think infection is probably the number one, and people say, well, how am I going to know if I have an infection in my knee? What do you tell them?
Well, it's impossible to know with 100% certainty just by looking at the knee, but generally, if you're getting better, let's say, do you feel better this week than you did last week, and last week than you did the week before? If you're getting better, especially in those early first few weeks, then you're unlikely experiencing an infection. And an infection would give you pain that is getting worse. The other sign of infection would be redness and swelling. But guess what? After a knee replacement, your knee is red and swollen. So if your knee is generally looking better, the redness is getting better, the swelling's getting better, then there's not likely an infection. But if things are getting worse, then there might be an infection.
Or if the wound's starting to pull apart, or heaven forbid if there's pus. Thankfully, the early infections are pretty uncommon. So at a week, the odds of having a deep infection in your knee seem to be actually quite low, but sometimes it will show up a little bit later. But like Paul said, deteriorating function certainly is a big concern, which I think brings me to another point. How do you know if you're doing okay as far as range of motion? My patients say, hey, I was told by my physiotherapist I have 80% range of motion.
Yeah. The way we like to measure range is in degrees.
Yes, not percent.
Yeah, not percent. So we think about your knee straight out, it's at 0 degrees, and when you bend it like you're sitting in a chair, that's about 90 degrees. And we aim for more than 90 degrees. We'd like you to have more than 90 degrees, and we'd like you to get out straight to as close to 0 degrees as you can.
Yep.
So definitely, work with your physiotherapist to get that range going. So we've talked about a blood clot, something that can go wrong, infection, something that could be going wrong, developing some stiffness that you can't get through could be a sign something's going wrong. And then there's the other sort of general health things that can go wrong after a knee replacement, but that can happen anytime. If you're getting chest pain, shortness of breath, any worrisome symptoms like that, you should get back to an emergency room or your doctor as soon as possible.
Those are all good points.
Okay, so we've got you home, we've got you doing some physio, we've got you when you're going to drive, when you're going to travel, when you're going to go back to work.
Sports, what about sports?
Yeah, sports after. That's a good question. First of all, what kind of sports can you do with your knee replacement? We've discussed this before when we've talked about knee replacement in our other videos. You know,
Generally, I tell people to try to avoid repetitive, high-impact stuff, but otherwise they can do most things with the understanding that they have an artificial knee that's made out of metal and plastic, so you probably have to kind of back it up just a little bit from what you're doing before.
Yeah. And what about golf? That's a common one. When can I go?
I love playing golf.
I do too.
Yeah, so I tell them 3 months.
3 months for golf?
Yeah, I say if you want to start sooner, I'd tell you to work on your chipping and putting, which is where all the money is anyway, inside of 125 yards.
Good point. Yeah, I'm the same. It's about 3 months, but you can start putting, start chipping a little earlier. And I'll say when you get back into it, you know, if you have a shot where you normally would use 7-iron, maybe ease up and take a lighter swing with a 5-iron.
Really? You give them that kind of?
I go right in there.
Okay, I like that. Yeah. I will also tell them maybe they should consider taking a cart, or maybe taking a cart for the back 9 if they feel like walking it might be too much.
I always take a cart. Just the way.
Golf is an exercise, so don't try to trick yourself into thinking that it is.
I've only got a limited time. I want to have fun.
I like it.
Okay, so can you think of anything else?
No.
After any other types of questions we usually get? I got a good one. When can I have the other side done? So
some people do them both at the same time. That's not something that I do, but certainly lots of centers do that. We've talked about it in other videos why we feel that maybe that's not best for us. But what I do tell people is my standard answer is 3 months, mostly to allow you to recover your blood count, have the wound healed, avoid any acute complications, and forget how much it hurt.
That's right. Okay, so that's pretty well what you can expect when you get home from your knee replacement.
If you have any other questions about other topics that you'd like us to go over, please feel free to email us at talkingwithdocs@gmail.com.